there is an immense tension with faith and science. I would argue maybe not as tense as people like to think. I'm coming into medicine and passionate about helping people and providing good care, following research, following science, bringing people evidence-based medicine. And yet I am trying to figure out, well, how do I bring all of me to work?
Insomnia really is suffering to me. This stinks. Yeah. But what I think a lot of my patients sometimes have difficulty realizing, insomnia is the symptom and your brain goes crazy. And it's so hard to separate these almost abnormal feelings that come about from the change in brain chemistry from insomnia. It's a vicious swirl. But to get out of that spiral, one of the anchors was, there is a reason behind this.
It was a 3-year prospective study that looked at a sample of Chinese Protestants. What they found actually were people who were having significant sleep problems. They were more likely to have left their religious faith 3 years later compared to the people who were not having significant struggles. If I'm having some kind of spiritual existential crisis, then that can be really disrupting to my sleep. I need to reconcile with this research and really not let my own discomfort be in the way of patients who they might have an intervention that could really help them that wouldn't help someone obviously who's an atheist or agnostic or something of that nature.
Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Alison Kole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same.
Well, hello, everyone, and welcome to another episode of the Sleep is My Waking Passion podcast. You know me, I'm your host, Dr. Alison Kole, and today I am joined by Dr. Benjamin Long. Thank you for coming.
Thank you for having me
on the show. He actually reached out to me, which is really fun, and we're going to talk about why it's so fun for me in a moment. He happens to be a dual board-certified sleep medicine physician and pediatrician, who is also currently pursuing a master's degree with a concentration on theological understanding of sleep. He's the debut author of a sleep journal that is a very unique sleep journal. It's called the Sleep Habits Journal, Practices, Prayers, and Devotions to Ease Your Sleepless Nights, and it is being published by Ink and Willow. And this is a project that intentionally integrates faith and science to better support religious patients who are struggling with insomnia. His work sits right at the intersection of cognitive behavioral therapy for insomnia, which is incredibly evidence-based, as well as a Christian spiritual foundation. And it's kind of asking how our beliefs, practices, and worldviews shape the way we experience and treat sleepless nights. So it's a very unique perspective, but still very evidence-based. So before I dive in with Ben, I wanted to be transparent. If you were listening to this episode now and you're like, that is not me. I'm not that religious. I feel like this is going to be a show that's going to be a little Christian forward, and that is not my jam. This episode may not be for you, okay? It's okay. I'm letting you know right now. You can pop off. If you are interested and curious, which I certainly am, please stick around because, while this may not be everyone's cup of tea, it's okay for us to talk about stuff that may not be your cup of tea. And by the end of the episode, maybe you go, maybe it really is kind of my cup of tea. I encourage having an open mind about these discussions, but I'm going to respect if you need to kindly pop off on this episode. So today we're going to be talking about prayer, scripture, and theology alongside standard cognitive behavioral therapy for insomnia and sleep science, and with an eye toward what this integration means for patients who really are very spiritually and religiously inclined, where this is really a central part of their core beings. It's just such a fascinating way to look at things, Ben. So I wanted to start with, how the heck did you decide that you were going to go from really medicine where, right, we are kind of brought up in the medical system. We kind of shy away from, we want to be very inclusive. We also were very careful to try to really form good relationships with the people that we're trying to help, our patients. And this means being very open-minded to different cultures, different religions, different spiritual beliefs. How did this trajectory of your career go that now you're kind of exploring theology and then decided, to create this journal? Tell me about this.
Yeah, has been a haphazard is probably the best word to describe it. There's not like a clear moments per se. I think a lot of it was just my own journey of personal integration. Exactly how you're starting this episode, there is an immense tension with faith and science. I would argue maybe not as tense as people like to think. It's a very complex and multifaceted relationship. But just as someone who is a Christian and comes from a faith tradition, I explain it as being a citizen of two different nations. I'm coming into medicine and passionate about helping people and providing good care, following research, following science, bringing people evidence-based medicine. And yet I am trying to figure out, how do I bring all of me to work? For us as physicians going through medical education, there is a bit of we're bringing our formed identities to the profession, and we all have to, in one way or another, figure out how that actually fits into being a physician. And so I think, for good reason that we know as there is a diversity of people who become physicians, that serves our very pluralistic and diverse country that we find ourselves in. So rightfully so, there are good support groups for like women in medicine, or if you're a minority in medicine or things like that. And there are groups that I think provide community for people who have similar faith backgrounds as well. And I was able to experience that. But there is this question that was kind of nagging at me of like, how do I practice medicine as a Christian? Like, how really should that impact how I see people, how I see medicine, what I'm trying to do? And obviously also in a way that is very understanding of the dynamic that's at play here as far as like the patient-physician relationship, the power difference that occurs there. So an immense responsibility too of not trying to, I think people hear integration and sometimes they might hear like proselytizing or like sharing my faith or trying to convert my patients or things of that nature. And that's not necessarily what I'm talking about. It's how does my worldview and the identity that I have, how does that impact how I show up to work? And how can I bring my best to the patients that I serve? So that just was my own journey. And then as I'm thinking about that, reading about that, and learning all of this stuff as far as like the history of medicine and how medicine has grown just in its own as a enterprise and industry from ancient times, and looking at history of the Enlightenment and modernism and how these things have kind of impacted how medicine is thought about or practiced, or how we look at people and bodies. And that just led me more and more to this place of feeling like there was something kind of missing in what I was able to deliver to my patients. And so as I kind of gotten more niche into sleep medicine and sleep specifically, I noticed as I was accompanying people in their own journeys through their sleeplessness, I wanted to see, we all have those patients that we come to the kind of the end of the road, and it's like, I've tried everything in my toolbox and nothing is really better. In one way or another, I was like, is there something else that I can do to kind of help people? Is there some other kind of resource? And out of really just like a curiosity, I was like, I wonder if the Bible has to say something about sleep. And if you just do a quick word search, it comes up a lot. And so I wanted to figure out, okay, I feel like there's something here. There's something at this intersection. There's all this resonance, but I don't really know how it all fits together. And so that's really the journey that I've been on, is trying to figure out these two different worlds. That's a lot of tension, that people often put themselves as enemies, but I feel like I'm a citizen of both. how can I be a bridge? How can I do that and show up for the people that I serve?
Well, I have to say, having reviewed the sleep journal, I really feel strongly that the reason I wanted to have you on the show is because you start off right away with the science. And there are a lot of books that people can read that will go over all the various factors. We always look at, we all have maybe a predisposing reason for us to have difficulty with sleeping. What are the factors that maybe precipitated you into getting into your current insomnia state? What is perpetuating that current insomnia state? That's what we call actually it's like 4 Ps now, but it used to be called the 3P model for insomnia. And the bottom line is that that's incredibly evidence-based. So if you're someone who's looking at this and listening to this and going, okay, well, how does this help me? What I can tell you is that's true cognitive behavioral therapy. What I have found in my own insomnia journey, and one of the reasons I wanted to talk to you was when I was looking at, there was a precipitating factor. It was COVID and shift work and accumulated stress over years and years of years and practicing at a very high level and being very busy. That's the clear picture. But then there comes well, how the heck do I get out of this piece of it? And one of the themes that really helped anchor me because of my Christian faith was the fact that I held on to this thread of, I know I'm suffering right now. Insomnia really is suffering to me. This stinks. Yeah. But what I think a lot of my patients sometimes have difficulty realizing, and I try to get them there, is it's not the insomnia is the symptom, and you're feeling that suffering. And your brain goes crazy, and it's so hard to separate these almost abnormal feelings that come about from the change in brain chemistry from insomnia. It's a vicious swirl, and it's complicated and complex, as you mentioned. But to get out of that spiral, one of the anchors was there is a reason behind this. And if I could just kind of figure out what that reason is, I'm going to slowly begin to get that. It's going to take a long time for me. It took a year, but that spiral is going to slowly stop. And I'm going to still be that typical chronic insomnia patients where most of the time it's okay. Other times I'm not sleeping so great. But if the majority of the time I'm okay, that's my challenge, and that's fine. And that's, it's not about perfection. It's about progress, right? That's what we tell our patients. But for me, the anchor really was realizing that my Christian faith told me that God had a purpose for me. And I just knew that I was evolving out of what I assumed my purpose would be when I was 20 years younger, going through medical school, going through that. I'm going to be a big, bad pulmonary critical care sleep doctor. And that's what I'm going to do forever. And then suddenly I didn't want to do that anymore. And I'm like, but why? But why? But why? When you lay out your rules, yes, you're doing it in the frame, but you talk about something called Sleepless Night Rules. And this is really like your adaptation of stimulus control. If you can talk about stimulus control in the standard context so that we can define that for our listeners and then go into how you frame it with your sleepless night rules. This is how you're starting to integrate those Christian elements. Let's get into that a little bit because that really resonated with me. And I didn't have a framework, as I was telling you before we got on, to really define that. And I'm reading your journal. I'm like, I think he kind of got into my brain a little bit, but I hadn't organized it that way,
Yeah, absolutely. Yeah. So stimulus control therapy, for anyone who's listening that's not aware. So really that comes out of a behaviorism, operant conditioning kind of framework of psychology. And so it's treating actually falling asleep as conceptualizing as an instrumental act or an operant. And so then we're, following of trying to look at, are there stimuli that you have that are not compatible with being able to fall asleep? And so trying to remove those stimulus. So then out of that came the stimulus control instructions. So typically how I talk to my patients about that is usually just like you are trying to wait until you're actually feeling sleepy to fall asleep or get into bed. And then if you can't fall asleep, it varies depending upon who you're talking to for stimulus control. I think like the original Bootson article, I think says something like 10 minutes or something like that. Sometimes I don't even put a time on it because I'm just like, whenever you feel like you're not falling asleep, get out of bed. And so, traditionally stimulus control, we'll say 10 minutes, 15 minutes or something like that. Get out of bed and then wait to feel sleepy again. And then you're going to lay back down and then repeat that until you actually fall asleep. And then there's the caveats of you're only using your bed for sleep and for sex. and you are, trying to have a consistent bedtime and wake time and also have no naps during the day. And so all of those things kind of give the guideline of essentially utilizing your sleep pressure that is going to build over the course of several days. Because I, tell all my patients, you're going to have a terrible night. This isn't magic. Like your first night is not going to be great.
This is the hard stuff.
This is the hard part.
This is the hard way to go, but it's the most effective.
Exactly. It's going to get worse before it gets better, but hang on. So usually the first couple nights we have some terrible nights, but we're building our sleep pressure. We're not taking long naps. That is going to take that away. And we're having a consistent wake time till eventually you're going to have some consolidation of your sleep. And isn't a magic therapy that all of a sudden gives you 10 hours of sleep. We're going to get you what your body is able to produce and consolidate. But we know you're going to be more efficient with your sleep. You're going to be able to fall asleep quicker. And then also we know of subjective measurements of sleep that you're going to have improved satisfaction from your sleep because you're having those longer periods. And so that's really the stimulus control instructions. And really that is what the Sleepless Night Rules are. I had a lot of mixed feelings about writing this book because I am such a physician first. I was like, okay, well, I have to test my Sleepless Night Rules first before I can even publish a book because it's different from the stimulus control instructions. And if I'm making some kind of change, then I don't want to promise, people that it's actually going to, make their sleep better if it's not the exact same thing. I was getting too analytical in it in some ways, but at the flip side, I'm like, okay, I'm building this off of an understanding of the same recommendations in the stimulus control instructions. So how I frame the Sleepless Night Rules is cease before bed and wait until you're feeling sleepy. And then if you can't fall asleep, that same thing, rise out of bed. And then the third one that is arguably the most important kind of tweak or difference is to connect with God and wait to feel sleepy. And then repeat for step 4, repeat rules 2 and 3 until you fall asleep, and then resist sleeping in and taking naps. So you can tell just from the surface that pretty much is the stimulus control instructions, which I think is what hit me in my sleep medicine fellowship. And as I was learning about cognitive behavioral therapy for insomnia and just me as a practicing Christian and reading my Bible and going through the Psalms, I'm like, I'm seeing some kind of parallel here of these ancient writers who are struggling with their own really terrible circumstances. The original context of the Psalms goes through a part of Israel's history where their whole way of life is destroyed. They have a neighboring culture that comes in and wrecks everything and kills so many people, and they're pushed out into exile. And that's these people who are struggling with God, if we are your chosen people, why is this kind of happening? So really, really, really heavy stuff. And then what you see as you read them is that they're doing some really similar things. There's a verse towards the beginning of the Psalms that talks about meditating in your heart upon your bed. And then another verse that talks about rising from your bed when they can't sleep and connecting with God. And so it was I was seeing all of these moments of clarity and parallelism. And I was like, there's got to be something here because I'm seeing both things in both realms.
I wanted to say that normally, depending on what your faith is or how you approach it, for some people, they just need to be busy or doing something. Sitting still is going to be the antithesis of what's going to get them back to sleep. Yeah. So understand, for those who are listening, there are multiple ways to approach getting back to sleep. And Ben is not covering all of them, and nor am I expecting him to. But I can say in my personal experience, for me, kind of distracting my mind wasn't settling to me when I couldn't sleep. So really, and occasionally, believe me, occasionally I would just be like, forget it. I've had enough. Enough is enough. And I'd put on, it would often be a show that gave me great comfort. For some reason, Magnum PI in his red car was one of them. I think it was taking me back to when I was a kid. Yeah. And multiple episodes of Park and Rec. So I've said that to my patients often, that because I know how it goes. I know there's nothing scary in it. And for some reason, for me, there would be times when that distraction would work. If I was in a different frame of mind, however, you don't just need to do the same thing all the time. Sometimes it's good to reflect. And so when I was going through part of where I struggled with sleep would be I'd have this, all of a sudden, this I'd be going. And then I had this active brain about what I wanted to do and where God was taking me. For me, then it became journaling as my form of prayer, putting my thoughts onto paper. That sometimes works for some folks. And so I think your perspective, though, really at the end of the day is exactly what I found probably propelled me forward more, was less of the distracting stuff. When I was really not ready to deal with stuff, yeah, the distraction was what was necessary. Right. But once I got into the frame of mind where I was open to having a better relationship with God and thinking about those difficult things and really processing it, sometimes, especially for us parents that may be very busy during the day on top of our jobs, sometimes that's the only time you get any peace or any time you get to really pray or meditate. So it's, in a way, using your time wisely.
Yeah.
Food for thought.
Absolutely. And I think that gets back to some of the roots of cognitive behavioral therapy as a form of therapy. In a way, I think some founders of behaviorism were kind of like, this is cool because it doesn't require introspection. We can just focus on your behaviors, and then that is going to have some kind of results, which when it works, great. Like there are definitely people who it's like, all I have to do is follow the stimulus control instructions, and that gives me the boundaries, and I'm back on and everything is good. But what it doesn't deal with is exactly what you're talking about. Things I am struggling with that require introspection, that are real struggles and problems and issues, whether that is like parenting or work stress, or whether it's even larger of grief of the loss of a loved one or experiencing abuse or neglect, or those things. Like those are like big barriers to sleep that, yeah, we can do CBT-I, but it's not going to be addressing those things that need more kind of work beyond that. And so I think that when you put it kind of within a Christian worldview and frame, all of life is, and from a Christian perspective, all of life is the spiritual life. I'm constantly, every day, making choices and having thoughts and moving through this world that is forming me into some kind of person. And so then I have all of these opportunities of these different paths to take. We see that just in normal like CBT-I, as far as like, I can either toss and turn and stay in my bed, or I can actually like get up. And if I stay tossing and turning, then I am a person who gets really frustrated at night and toss and turn all night. Versus if I get up out of bed, then I'm doing something different in response to that. And so that can get, especially us as scientists, we're like, ooh, anything subjective, I don't like, like touching there. We want to remove all the subjectivity so that way we can stay with as much of the objectivity. But the problem is that's not lived experience,
And sleep is definitely very subjective. It's a very interesting, we're very science driven, but yet there's so much level of subjective to it, right?
Absolutely. Absolutely.
You mentioned several worldviews that shape responses to insomnia. Consumeristic, sort of a scientistic, utilitarian, natural. Can you talk a little bit about what you mean by that and how that contrasts with Christian frame and how that might influence people when they, let's say they wake up in the middle of the night and they're just like, oh, I can't get back to sleep, which has happened, I'm sure, to all of us at some point, and some of us more frequently than others.
Yeah, I think a great place to start with this is, what are we talking about with like a worldview? Really, it's that we all are going to describe the universe, the life, everything within it, as far as terms of like what should and should not be, or like what exists and what does not exist. What is a good experience? What is a bad experience? And all of those things kind of shape how we see and show up and operate through the world. And some of that is, and usually a lot of that is not at the forefront of understanding. And there's also some discussion of now also talking more about social imaginaries, which is like the stories and narratives and myths and icons that kind of capture our hearts and imaginations. And so it's like influencing our practices as well. So like the things that I'm doing, the stories that I tell myself, the practices that I have is going to influence the way I'm thinking about things. And all of that is kind of standing behind our lives and what we're doing every single day. The problem with us as modern physicians is we're not really trained on that as far as a philosophy or a theology of understanding like what worldviews are and social imaginaries and how that is integrated into who we are as persons. And so we do a good job of having precision of measuring interventions and how to manage things and having evidence-based medicine and all those things, which are important. So definitely, want to say, like, I'm not saying like throw all of that away. That's good. And that has done really good things for us to alleviate people's suffering. But the problem is we can never escape our worldviews and our social imaginaries and our context and have, like, quote unquote, a God's eye view of what's going on. Like, we are always looking at all of creation from within creation. And so within the history of science, there was a certain kind of triumphalism where we thought, like, oh, now that we have the scientific method, we can do all of these things. We'll be able to describe all of the things of the universe. And I think as we have kind of progressed along that philosophical claim, then we have realized that there are these parts of reality that elude us as scientists and testing with the scientific method.
Well, I think there are some neuroscientists, though, just to kind of spitball on this and kind of take it a little further, that because this has really been fascinating me more recently, that are really looking at quantum physics and how what we think, what we believe, we're putting energy into that. And if we're all energetic beings and God is energy and we're all really one with that energy needs to go somewhere. And so I think we may be beginning to get on the other side of that in terms of now we've always seen science is over here, religion's over here. But if really what we're dealing with in terms of religion and beliefs is in part kind of predicated on a scientific principle, I think we're kind of getting closer to that. I'm curious what you think about that, because I feel intuitively that I actually think that that's where we're going. Yeah. And I think there's some validity to that, even if I cannot describe it very well scientifically.
Yeah, I totally agree, because I think even us just like having this conversation of what does it look like to integrate these two things, like probably even like 50 years ago would have been really difficult to have, because there was still, I think, a lot of animosity and tension. And I think that makes sense when you look at the history of things, because we lived in the world that would unfortunately try to take theology to be understanding of the created world. And so kind of create scientific observations from theology, which that's not what theology is. Theology is anytime you are talking about God, then that is the study of theology and trying to understand who is God and how has God revealed God to us. That's what theologians are trying to do from a variety of different kind of perspectives. So obviously that is a very different question that we're not going to ever be able to have in some kind of experiment in a lab to be able to test theological kind of claims. And so, we have gotten to a point where we're realizing, okay, there are some things that are significant problems. Consciousness is one of those, or to extend that to sleep, dreams. I cannot draw blood work for your dreams and have like dream labs that I'm able to ascertain what's going on. We know that there are neural correlates to your brain so that your visual cortex is lighting up. So that shows like, okay, it looks like your brain thinks that you're actually seeing the things when you are dreaming. But there is no physical explanation for the experience of dreams, actual lived direct experience. And really there's a really awesome book I would recommend to people called The Blind Spot that talks about exactly this, of where we have separated so much from direct experience that we've created this amnesia or blind spot in science to not be able to talk about direct experience. So dreams would probably be a pretty good example of that, in that we can misplace, there's a fallacy of misplaced concreteness, where you are saying our precise methods of measuring things is the real thing. So if I'm talking about sleep, the hypnogram, the brain waves, all of those things, those are very precise measurements of sleep and show us reveal things about sleep, but that is not the direct experience of sleep itself. And so what can happen as we have these very like precise tools is we can kind of ascend the stair of increasing abstraction of like, okay, well, maybe we can analyze the EEG waveforms enough to be able to like recreate dreams or be able to figure out something about dreams. And so you can kind of keep going in some kind of certain trajectory, but that's taking you farther and farther away from dreams as an actual experience. And so for waking, our consciousness, if you talk to any neuroscientist and say, is there a physical explanation for consciousness? That's not anything that we have found. We know what's happening in the brain, and there are correlates that we have that do really powerful things, and there are very powerful methods to reveal things about what's happening in the world. But if a neurosurgeon opens your brain and, zaps a part of your brain that's going to like your hippocampus to stimulate some memory, there's no way for us to replicate your memory that you would have into someone else's memory for them to have. We don't have a way of doing that. And so
outside of Hollywood and movies, maybe.
Yeah, exactly.
Not in real life.
Not in real life.
IRL, as they say, as all the cool kids say.
We know that there are some limitations to what we can discover about the reality with science and the scientific method. And so I think there's an increasing collaboration to talk about then what are other disciplines saying of things. And so that can get into philosophy and theology and things of that nature. So to get back to your question about like our worldviews and how they influence how we respond to sleeplessness, then, really that goes into, we've been talking a lot about the scientistic. So a scientistic worldview, that is a philosophical claim. That most commonly is going to be, you can only know things if it can be proved by the hard or soft sciences, depending upon your stance. So the only true knowledge is knowledge that is gained in some kind of a lab that it can be quantified or measured. The problem with scientism is even that direct claim is a philosophical truth claim that cannot be tested in a lab. So you're also kind of like self-refuting when you're getting into a scientific worldview, if you're a hard scientific worldview. But we can respond to our sleeplessness by, well, if I can just tweak the right things, if I can learn the right things about my brain and do all of these therapies, and that is just going to fix my sleep. And I think that is going to definitely improve lots of people's sleep, and you're going to have better sleep habits and better sleep efficiency. And we can go into like a whole long thing, but it is coming out of a specific worldview of, I'm going to respond to my sleeplessness with science. Same thing with a consumeristic for Americans. It's like, let me buy something, some supplement or some gadget or something in order to fix my sleep problem. So we see that problem. And then as a consumer, that is kind of ingrained within us. We're like, I'm going to buy something in order to kind of fix that. And then that utilitarian, some of that like very practical, you probably hear this all the time as a fellow sleep doctor, that people will say, well, if I can't sleep, I might as well be productive. And there is this high
I'm guilty
value. Yeah, same. Me too. Absolutely. And it's like, there's a high value on productivity, efficiency. And so that even when we can't sleep, that is something kind of that we turn to. And so the reason that I like to bring that up is every single patient that we have is bringing some kind of worldview and social imaginary and expectations of what sleep should or should not do for them, or how they should respond to sleeplessness or not. And so from a Christian worldview, then you're going to have certain claims about reality from a religious worldview. For Christians, that's going to be, that there is a creator, and that not only a creator, but someone who continues to sustain the universe. And so you can already see, if I have that specific worldview, then that's going to lead me to a different response to sleeplessness. If I believe that there's someone who I can have a personal relationship that is involved with the world continuing and sustaining and running, that can lead to a certain level of trust and kind of letting go and saying, like, I can fall asleep trusting that there is a God who makes things continue to happen. That really my idea of control is an illusion because God is the one who's kind of in control. That's a very different narrative and worldview and imaginary compared to someone who's coming from not that worldview. And so it's important for us to bring that to the forefront to understand that our patients are coming in with those diverse worldviews.
So in that lens, what worldview do you think fellow sleep doctors who might be really a little nervous to even broach this subject, what worldview is your sleep habits journal, do you think really touching upon if we could identify that specific patient? Because that's kind of where I'm understanding the conversation to be going. And I'm really curious because that gets to the practicality of how people can find and potentially utilize this sleep habits journal if they can help to find that patient that they think could lean into this and really benefit from this approach.
Absolutely. Yeah. And really, it just starts with just kind of asking your patients the question of getting some kind of spiritual history. There are actual spiritual history inventories and questionnaires and frameworks that have, good research behind them. Most of the time, because of the nature of that kind of medicine, especially like end-of-life care or hospice care or things like that, they're very robust questionnaires and supports at that point because that's an important part of that medicine. So not as much in sleep medicine, but a way that you can just ask that I use in my practice is you just ask, is religion or spirituality an important part of your daily life, is how I ask it. And then the great thing is that just kind of opens the door for conversation. When you look at the research of Americans' attitudes toward being asked about their religion or spirituality, very open. Research has shown that people aren't, I think some people think people are going to get offended, and there's no evidence to say that somehow hurts the doctor-patient relationship by asking that part of people's lives. If anything, there tends to be a very openness of I'm totally fine with my physician asking me that question. And then anecdotally, me personally, I've now asked hundreds of people of that question. And I honestly can't even tell you one time where someone, no one has ever gotten out and I can't believe you asked me that and left the room or something like that. So just being curious to ask. And then the great thing is then I very often have people say, nope. And I'm like, okay, no, this is not something that is important for you or a goal for you. And we can move on with our encounter I had never even asked that question. But then when someone says yes, that just opens up the door to a different conversation. And I often tell people of any question that I ask in my medical histories, a spiritual history is surprisingly something that when someone says yes, it always really colors the conversation in an interesting way. Because sometimes for sleep, sometimes that is the thing that is impacting people's sleep. I don't want to be on here to say that Christianity is perfect. Obviously, we have a whole history that has shown that has not been the case, unfortunately. And so real church hurt and trauma and things that have happened that have been harmful to people. And sometimes that is the thing that is really impacting someone's sleep. And maybe they wouldn't even bring that up. I've actually had that conversation that afterwards I was I don't even know if they would have necessarily brought that up if I had not at least asked.
Do you think it influences the outcome? Do you think that by asking that, you've been able to change the trajectory of someone's poor sleep to better as a result?
I would say of the handful of patients that I've had of that, I would say it definitely helps inform me of kind of having a better picture of who's sitting across from me. And and also just then I can kind of circle back around. I had a patient who they were exiting their faith. And actually, there's a really interesting study that was done out of China in 2018. It was a 3-year perspective study that looked at a sample of Chinese Protestants that, they're just kind of taking surveys and checking in on them. And what they found actually were people who were having significant sleep problems. They were more likely to have left their religious faith 3 years later compared to the people who were not having significant struggles, which would kind of make sense if I'm having some kind of spiritual existential crisis, then that can be really disrupting to my sleep. And one way or another, I'm going to figure out, try to relieve that tension. And for some people, that means leaving their faith. So sometimes, yes, that has been helpful just in as I am walking alongside people, figuring out, hey, last time you said that this is something you're really struggling with. How are things going with that? And that kind of gives a little bit of insight. And sometimes also how my medical decision making of how we're going to tackle the sleep problem. I view it as kind of another piece of the puzzle. And I'm okay, this is a really big thing that is happening in your life right now. Maybe it's not the best time to be really aggressive with starting CBT-I or something. Maybe there's something else that we can focus on or talk about, or maybe have some kind of graduated approach before we're kind of jumping in. So I feel that's been the best thing for me is just really understanding where people are at and how, and their readiness for change. because sometimes there can be so many things going on in people's lives that they're just not ready to make those changes that they need to address their sleep.
Hey, this has been such a fun conversation. Any final words that you'd like to leave here with? And then please share with anyone where they can find more information about you, where they can find information about this book if they're interested. And of course, I will have links and everything in my description, in the newsletter, etc.
Yeah. I would say my final thing is kind of along the same thing, being curious. Like, it's such a privilege for us to be able to sit across from people and hear their stories and hear what's going on in their lives and be entrusted with that, and then accompany them through their journey through the sleepless night. And so that curiosity to know your patient and see your patient, I think, is really beneficial for the therapeutic relationship. And that spirituality or religiosity is an important part of people's identities. And so especially if it's something that you're uncomfortable with, I would just challenge people to reflect and go on a little bit of a journey of your own discomfort too. Because a little bit of a challenge, I think most of the time, if I talk to a fellow physician and I ask them, think of a clinical case where someone's religion impacts their healthcare. The first thing probably most people think of is a Jehovah's Witness who needs a blood transfusion.
That would be one of the classic examples for sure.
You know, like that is like the one that pretty much all people in medical school are they'll have a multitude of other different kind of cases, but that case always comes up, and that's always a discussion at some point in our ethics curriculums. And so I think because of that has colored a little bit of the understanding of this intersection of religion and health. And there actually is a very robust body of research now even coming into sleep as well, of looking at sleep quality and these connections between religiosity, whether that's personal beliefs or behaviors or religious service attendance or all of these things that are actually connected to better sleep quality. And so us as physicians, I would argue, our imperative of having taken the Hippocratic Oath and trying to advocate for our patients and present the best for them is I need to reconcile with this research and really not let my own discomfort be in the way of patients who they might have an intervention that could really help them that wouldn't help someone obviously who's an atheist or agnostic or something of that nature. So having curiosity and being able to dive in, I think, would be the last thing I'd say.
That's a great message. We have to stay curious and we have to stay cognitively flexible as new data comes out. I think we all, as younger physicians, I think we can stay in the game longer, and our shared lived experience over years and years and years of taking care of patients can really benefit not only our patients, but our younger generation of clinicians. But the way we stay relevant is we remain cognitively flexible. And I think the Sleep Habits Journal is a representation of that. So thank you for your hard work in doing this, for your unique approach to sleep care, which is amazing. Where can people find you? Tell me about it.
Yeah, the easiest place if you want to learn more about the journal is just go to sleephabitsjournal.com. That also just takes you to my website. So I'm just starting to Substack. So if this is this is really fascinating and I want to learn more, you can sign up on my website for my Substack, and I will talk about all things sleep medicine to theology and everything in between. So sometimes I might write about new sleep science articles and stuff that comes out, or more of that sleep quality and religion research, or sometimes what I'm learning in seminary or things of that nature as well. So that would probably be the best place to find me.
Thank you so much for joining me, Ben. It's really been a pleasure, and I so appreciate that you reached out. What a wonderful and unique topic to discuss today.
Yeah, this has been so great, so fun, and just really appreciate your thoughtfulness to this topic.
You're welcome.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com And while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.